Good morning, everyone. I see there are quite a few people already in the room, and I would like to thank everyone for coming today. And as you all know, every year we do a day at the Capitol to share our thanks and our appreciation for individuals who support mental health and mental wellness across the state. And this year we have Molly Patera, who is from the Department of Mental Health. We also have Kay Denault, who works with Mental Health Association of South Mississippi. And I'm Satania Wimbley. I'm with NAMI, Mississippi. So today, as you all are still coming in, we have quite a few people. We want to thank you all for being here also. And I want to go ahead and get started to be respectful of each of your time frames and things that you may have going on. So I want to introduce our first speaker today, Miss Wendy Bailey. Wendy Bailey currently serves as the Executive Director of the Mississippi Department of Mental Health, a role she assumed in January of 2021. She has been with the agency for over 16 years, and she began her career at Mississippi State Hospital back in 2005. She received her bachelor's degree from Belhaven University and her master's degree from Webster University. She is a graduate of the John C. Stennis Institute of Government and Licensed Mental Health Administrators and Certified Public Manager. Ms. Bailey serves on numerous boards and task forces, including the Governor's School Safety Task Force, Southeast Mental Health Technology Transfer Center Advisory Board, Board for the Mississippi Department of Rehab Services, State Early Childhood Advisory Board, and the Mississippi Suicide Prevention Task Force. She serves as a liaison with national organizations such as Mental Health America, Substance Abuse and Mental Health Services Administration, and National Association of Mental Health Program Directors Research Institute. She has been the recipient of numerous awards for her work during her years at the Department of Mental Health, including NAMI Mississippi Visionary Leadership Award in 2019. During her years at the agency, she was instrumental in the creation of the state's first comprehensive suicide prevention plan, in the development of Think Recovery, which partners with certified peer support specialists to focus on recovery-oriented systems of care, led efforts in the area of school safety and efforts to dispel the stigma associated with mental health, and the coordination of the agency's strategic planning process. Everyone, I give to you Miss Wendy Bailey.
Thank you, Sataniel. Good morning, and I want to thank the Mental Health Association of South Mississippi and NAMI Mississippi for inviting me to join you for Mental Health Day at the Capitol today. I know it's a little bit different doing it virtual, but welcome to 2020 and 2021. It is a joy to see so many of you on the call today who have made a tremendous impact on the state's mental health system over the last year. We know that 2020 became one of the most challenging years in our state's history, and as well as one that had a very deep impact to the mental health of our fellow Mississippians. People across our state have and are still feeling stress for many reasons right now. There are feelings of anger, frustration, anxiety, fear, and all of these throughout the last year with the COVID-19 pandemic are very common. But it's important to remember that everyone responds differently to stress and that we need to make our mental health a priority for ourselves and our loved ones. In response to the pandemic, DMH worked with a lot of partners to launch a Behind the Mask campaign to encourage Mississippians who are experiencing symptoms to seek help. And as a state, we need to create environments and relationships that promote that acceptance for mental health. You know, we talk about our physical health problems, and we should do the same with our mental health problems. Topics and conversations about stress and anxiety and depression, they're just not as openly discussed. We probably all have friends and family who have mentioned that they've been diagnosed with high blood pressure or high cholesterol, but I'm sure we know fewer who talk about their depression and their anxiety. So stigma is still a challenge in creating a culture of health in the mental health arena, like Sataniel mentioned a few moments ago. So my primary vision for DMH is to improve access to a full evidence-based continuum of care for people who have mental illness, intellectual and developmental disabilities, and substance use addiction. Mississippians should have the opportunity to live and be included in their communities, and services should be provided on a continuum of where that person is at that time and what their needs are. And this is possible with the continued support of our legislators. With the legislature's support, additional community programs such as supported employment, peer support services, housing, and more have all been expanded over the last several years. This is also possible with strong partnerships with families, advocates, other state agencies, and stakeholders to bring change and growth. Stakeholders such as the Mental Health Association of South Mississippi and NAMI Mississippi, which are partners in today's event. As we embark on a new year, there are several initiatives that will be a focus of our agency. This includes increasing the number of beds for Mississippians that are in need of alcohol and drug services. This includes expanding efforts around trauma-informed care and expanding peer support services through a peer bridger program at our state hospitals and our community mental health centers to try to enhance transition planning to the community and that continuity of care as people return to the community. We also want to look at the funding and increasing the number of people served with the ID/DD home and community-based waiver. And we also want to look at creating a solid roadmap for the implementation of 988. This is something that Congress recently passed, and it's going to be a 3-number call system for the National Suicide Prevention Lifeline. And it will launch in our state and across the country in the summer of 2022, which will be here before we know it. These and additional goals cannot come to fruition without the support of our staff, without the support of stakeholders across our state, and without the support of our legislators and advocacy partners. You know, we look forward to continuing to work together to continue these efforts and to grow Mississippi's mental health system and to make it stronger. I've spoken about looking towards the future and some of the future plans for the next year, but I also want to highlight some of the progress that has already been made. And that progress has been made because of so many of you that are on the call today. I believe it's very important to embrace new ideas and to embrace change. And I know so many of you feel exactly the same way. So we want to look at dynamic and innovative ways that we can provide evidence-based and best practices and services and supports to try to look at creative solutions to inspire hope and to help people obtain their goals. In 2014, the legislature first provided dedicated funding for the expansion of community-based services, and since has continued and has increased that funding. The Department of Mental Health has also supplemented that funding with appropriations that had previously been dedicated to the institutions in our state, and that funding was shifted to expand community services. So now we have a variety of community services and supports that are available in all 82 counties. This includes mobile crisis response teams, PAC teams, programs of assertive community treatment, I-Court teams, another variety of an intensive service that we call I-Court, and it's an intensive community outreach and recovery team, and other intensive community supports provided through intensive community support specialists in our state. We have focused on expanding these services across our state over the last several years to where Mississippians have access to the least restrictive care that they need in the least restrictive environment that is appropriate for their needs. Over the last 9 years, the state has increased its spending for community services by more than $88 million and decreased its reliance on institutional care by more than $70 million. And these changes are making a difference in the lives of our neighbors, our family members, our loved ones, and our friends. and we are proud of that. We've also seen expansion in the area of supported employment, both for Mississippians who have serious mental illness and also for Mississippians who have intellectual and developmental disabilities. And this is because of businesses in our state and other agencies such as the Department of Rehabilitation Services and the community mental health centers, who have all come together to work to help employ people. We understand and we know the power and the pride that employment can bring to people. I mentioned the Peer Bridger project, and that is something that we want to see expanded over the next year, but that we've already expanded some. It is to try to improve the current transition process as people leave the state hospital and go to the community mental health centers to receive treatment. And it revolves around peer bridgers that are certified peer support specialists, and they serve as outreach liaisons to support people who are transitioning from the state hospital into outpatient care. We've had this project at North Mississippi for the last few years, and just this past fall expanded it to South Mississippi State Hospital and their partnering community mental health centers. And our goal is to see an increase in follow-up appointments and see a decrease in readmissions to the state hospitals. And we believe that the help from the certified peer support specialists for this, we believe this connection and this warm handoff will be invaluable to the state. We've also looked at the use of evidence-based practices at our DMH state-operated programs. And we know that that is paramount in ensuring quality services are being provided to Mississippians. Our programs are continuing to see an increase in the number of evidence-based practices that are used. Recently, they are begun utilizing wellness recovery action plans and illness management recovery while someone is at the state hospital. And then also, we are excited to implement a wide range of evidence-based practices in the alcohol and drug treatment centers across the state. In particular, looking at a new chemical dependency unit at East Mississippi State Hospital that will open early summer and will increase that access to alcohol and drug treatment beds in our state. We've also focused on early intervention with children and youth and a coordinated care approach with partners and advocacy groups across the state. This is something that we want to build upon in the next year as well. This includes social emotional learning curriculums in schools. It includes suicide prevention and mental health awareness and working with families and looking at wraparound services that are both person-centered for families and their children. In addition, we have looked at increasing the number of stakeholders who are trained in evidence-based practices. This includes criminal justice professionals, this includes law enforcement, substance use providers, school professionals, and others. The more people that we can make aware of mental health and the more people who are trained in how to recognize warning signs and make that connection with others and make that connection to treatment, the better and the stronger our state will be. Last year, despite a pandemic, there were 143 law enforcement officers who were trained in crisis intervention training. And this training helps law enforcement officers respond appropriately to someone who may be experiencing a mental health crisis. So as you can see, there is much work being done across the state by our staff, by our community providers, by our partners or advocates, our families, and other state agencies as well. This is just a brief snapshot of some of the activities that are occurring, and so many of you are a part of these activities and are part of these initiatives and are making it happen each and every day. Listening to the people that we serve and developing services and supports that inspire hope and encourage people to obtain their goals is absolutely a priority for us. And I look forward to working with you, with our legislators, with our families, with community partners and state leaders to look at initiatives that can open doors and that can increase the overall behavioral health of our state. We cannot do this alone, and we all have to be in this together. to make a difference. And we appreciate that continued support from our legislators and all of our partners. And in closing, I want to thank our next guest, who is Representative Kevin Felsher, who represents Harrison County. Representative Felsher has been gracious to tour DMH-operated programs over the last several months, and he has clearly shown his support of the state's mental health system and his support to see that to continue to grow and to improve, which in turn will improve the lives of our citizens. So I greatly appreciate his time today. And thank you, Sataniel.
Thank you so much, Wendy, for those wonderful words. And thank you for your continued partnership with individuals across the state who are supporting mental health and mental wellness. And now we will see more information on Kevin Felsher from this point forward.
All right, give me 1 second and we should have this video coming right up. Of course, nothing works when you want it to, right? Goodness. Hmm. So this is Kate, the Executive Director of the Mental Health Association of South Mississippi. And we're here today Mr. Kevin Felsher, who is a member of the House of Representatives from Mississippi. And I'd like to thank you, first of all, for being here with us. Thanks for having me, Kate. I appreciate the invitation. Wonderful. So, let's start with the legislative session. Are there any type of bills that are mental health related that things are considering in this session? What comes to mind is okay, let's see. This is frustrating, you guys. It's here, it's loaded in. Sataniel, are you able to see where it says show screen? There's supposed to be a drop-down menu, which worked earlier. And Mr. Felsher's video is there.
Let me look for it.
We just did a test run, guys, and it worked. Why isn't it working?
Okay, I will see if I can do it from my side. Let's
Okay.
try. Can you see that?
Yes. So this is Kay Denault, Executive Director of the Mental Health Association of South Mississippi. And we're here today with Mr. Kevin Felsher, who is a member of our House of Representatives from Mississippi. And so thank you, first of all, for being here with us.
Well, thanks for having me, Kay. I appreciate the invitation.
Good, that's wonderful. So, so let's start. It's the legislative session. Are there any type of bills that are mental health related that you guys are considering for this session?
Sure. What comes to mind is, I believe Senate Bill 2631, which is going to ensure that our telemedicine and our telehealth is able to continue, and our providers will be reimbursed at a acceptable rate where they can offer these services. As you know, one of the biggest challenges in mental health is keeping the patients on their meds and keeping the therapy sessions. So I found this one to be good. That's working its way through the process right now, and it's looking pretty promising. Also, Senate Bill 2021 that allows our state mental health coordinator, Bill Rosemont, to sort of streamline and assemble his team in a more efficient way. That one, I believe, has already been sent to the governor. So that one worked its way through thanks to Senator Bryan over there. And I think 2420, Senate Bill 2420, is a bill that Senator Wiggins and I have been working on in conjunction with each other to allow for a temporary one-year license for social workers and family and marriage therapists from other states to come in. And basically what it's tantamount to is they can get a temporary license for 1 year. And maybe that'll kind of help fill a void in the shortage we have in those fields. So those are some things we have going on right now that I can think about.
I think that's wonderful. We definitely, I'm sure every state needs more mental health services. So that feels like it opens more opportunities up for our people. So thank you guys for that very much. Of course, we've spent this last year in a strange place with the COVID-19 pandemic. Have there been any particular things that maybe any of your constituents have talked to you about, or anything that you've observed mental health wise that is happening to people during all of this?
Sure. Well, firsthand, my mother suffers from mental illness and has since I was at a young age. And so she's in an assisted living home. And I feel particularly sympathetic toward those folks because they're pretty much on lockdown right now and can't get out. So this sort of thing just exacerbates their condition that much more. So the two particular age groups I worry about with this are our elderly and our young people, grades K through 12. So much of their lives are centered around social events and athletics and whatnot. And a lot of that has been impeded with the COVID-19 pandemic. So I believe the quicker we can get back to normalcy, the better on those fronts.
I agree. At our organization, we get calls from people that are trying to figure out what to do and just feeling confused, whether for their self or their family member, and being in some situations this past year where, like you say, people are isolated, they don't have that regular support that they normally do. That can be a challenge.
Yes, a huge challenge. And for those who are already suffering from mental illness, it can be a huge challenge. But even for those who are borderline and don't really lapse into maybe a full mental illness diagnosis, but it could push them in that direction, because they're lacking those one or two things that gave them stability, some comfort, and some just kind of escape. They don't have that any longer. And what's worse is what they do have to replace it a lot of times is anxiety and isolation. And so, COVID-19 has had a huge effect, unfortunately, and it's an untold effect in many ways on our society. So again, the quicker we can get back to normalcy, and I will say, Governor Reeves is trying his best to get us back in that direction, and I appreciate that.
Absolutely. I know, people they're tired, and but we've been getting through it, and it seems like with the vaccinations, things are definitely moving toward a more positive situation.
It feels so.
Great. So I know you have children yourself. One of the questions that we talk about in our mental health first aid classes is, a lot of times people don't really understand what a mental illness might be. So if you had to explain to a young child, say an 8-year-old child, what is mental illness, how would you explain that?
Well, it's not easy, and I've had to have that conversation with both of my children because my mother does suffer from it. And what they wonder most is, um, the change in personality sometimes in behavior. And, what I try to tell them is, mental illness is a sickness, much like a um, head cold or the flu, except you can't see it and it doesn't go away so easily. And so the people who suffer from it, they have to get the medicines that can help them and the therapy that can help them. And often what can help them is just, what I try to explain to them is just seeing you and seeing your smile. And that can help them. That's their medicine for the day. So that's what I kind of try to talk to them about. It's very hard for them to comprehend, as it's hard for adults to comprehend what mental illness is in a lot of cases. So it's extremely tough on children of that age.
I think that was a great explanation. I loved how you said just seeing your smile is great medicine. That's one thing that we definitely believe in at Mental Health Association is that having those people surrounding you who are feel supportive, and sometimes it's a family member or a friend, but it could be, someone that you just maybe see at the grocery store and have a little conversation with, or they're there every day when you go get your cup of coffee or whatnot. um, all sorts of ways we get that support, but like we are saying, we're a little bit right now out of our element where we aren't having those connections. So uh, I know we might be getting a little tired of these meetings online, but it's been kind of nice that we still can stay connected that way for sure.
Absolutely. It beats nothing, but it's not as good as in person. I'll just say that.
Very true. Well, if there were someone out there who maybe was having some issues, and sometimes people, they may not even realize that what's going on with them is is out of the norm, I guess you say, whatever that normal is. Or maybe, that they don't realize that it's something they may need help for. So that's really, sometimes that's the biggest step is realizing that you may need to reach out to someone. You mentioned that you have a family member, so you have a little experience with mental health issues. What would you say to someone if they thought about maybe I should get some help? What would your thoughts be on that for them?
Sure. Well, just based off my anecdotal experience, I would say the first thing is talk to somebody, whether it's a friend, a colleague, or a loved one that you trust enough to just be a sounding board to. Tell them what you're going through, whether it's isolation, anxiety, depression, whatever it may be. See if, in some cases, that may be therapeutic enough if you can just find someone to speak with. And if you find that that's not enough, or that person says, you may need some professional help, why don't you see about a therapy session or something like that? Don't be afraid to pursue that, because based off my experiences, the quicker you intervene when you have mental health issues, the more favorable the outcome. And so I would say to people, if you're feeling a week of being down or 2 weeks of being down, that's one thing. But if it's ongoing and you really feel like you're in a rut that you just can't get out of, don't let it linger. Talk to someone about it and do not be scared. There's a plethora of places you can go that can offer assistance, and there's some great therapists and psychologists out there that could help if it rises to that level. But again, sometimes it doesn't even rise to that level. Sometimes it's just talking to a person or a group of people that you know and trust. So it could be a dinner out with friends where you open up to them and they kind of give you some objective advice or input. So I would recommend that.
I like that. And you mentioned just opening up to friends. I hope that people would feel comfortable doing that. I know our society in general, people sometimes are afraid to say anything. They don't want people to look at them differently or be perceived as weak or whatever. And that's unfortunate, because if we were talking about it more and the more people learn what a mental illness is all about, what those signs and symptoms are, then people would feel more comfortable with each other, but to get that help that they need.
Sure, and I do think we've come a long way over the decades of mental illness recognition and treatment, but I still think we have a long way to go, to your point. And so, yeah, I would hope that, always just be attentive. If someone's trying to talk to you, listen to them and be there for them, be a sounding board, and just be a support mechanism for them, because you never know, that can make all the difference in the world.
Thank you. Yes. So yeah, and Mental Health Association, the NAMI, the National Alliance for Mental Illness, and other advocacy organizations that we have in our state, you can call there and they'll try to help you navigate to whatever works for you, because one person's what they need might be completely different from someone else. We hear a lot of times in our office where people will say that they maybe they were on some medication, but either it made them feel the side effects, they stopped taking it because of the side effects, or they started feeling better, so they thought they didn't need it anymore. And both of those scenarios are really something that you should talk with your doctor about, because not everybody reacts the same way to medication, so it may take some different things until you kind of get the right combination.
Absolutely. Just from what I've observed, the medication aspect of mental health is one of the most challenging, because you got to keep your appointments, you got to take your meds daily, and even folks who try to just take a vitamin every day, sometimes you forget, or it's not that you want to. So that medication challenge is huge, and it's really a big part of being well mentally when you are prescribed those kind of medications.
I agree. And not everybody needs medication, so someone might be worried that's the only answer, and it's not necessarily. Like you said before, you may just need a little bit of some things that you can do in your daily life to kind of keep you on track.
Sure.
So are there any other things that you would like to comment on today? Anything you want someone to know about mental health and about what's happening in the legislature?
No, I would just say that I really feel great about where we're at in the legislature as far as um, having mental health top of mind, being willing to allocate funds toward that. And I know we have, I mentioned Bill Rosamond is going to be he's our state mental health coordinator. He's going to try to ensure that accessibility and quality is there for our state for mental health. Bo Chastain at our state hospital, I think he's doing a wonderful job. Wendy Bailey. And then there's just people like you with a servant's heart who are out there helping. So I just want to say thank you for that.
Well, we appreciate that, and I know you guys have so much on your plate. I can't imagine. You're away from your family for long periods of time and all sorts of things. So, people don't realize what you guys go through, and we thank you as well. Every one of you guys, thank you.
Thank you, Ken.
All right, sir. Thank you so much for being with us today, and we hope you enjoy the rest of the legislative session.
Well, I enjoyed it, and thank you for having me. And as always, anything I can do for y'all, please let me know.
And we definitely want to thank Representative Kevin Felcher. A lot of times it is hard to share your story, and that is one of the things that helps to stop the stigma of mental health, mental illness. It's just sharing your story. And for him to come on in his position and actually share his story, we greatly appreciate it. And especially in the time that we're in now. COVID is very real, as we all know, and it does take a toll on us, not just physically, mentally. And as the executive director of NAMI Mississippi, I urge each of you, if you are struggling or you feel that you are having an issue with your mental health, please feel free to give me a call at our office or call Kay with Mississippi Mental Health Association and just find out what your options are. For NAMI Mississippi, we offer support groups, presentations, and classes for individuals who live with a mental health issue or a family member. So we ask that if you feel that you are dealing with mental health issues, please feel free to join one of those classes just to determine if what you're feeling is mental health related. And we'd be glad to have anyone in any location at a class. Everything is currently done virtually. And now what we want to do is thank our legislators. They have given a lot for us and sacrificed a lot, just as Kay mentioned earlier. So what we did is we came up with a wonderful idea to just give them thanks. So here is a quick video to thank our legislators.
have to say that although we can't be together today, that seeing the pictures that you all have submitted for the video is so awesome, and is a little bit of a solace to not being able to see one another in person. We had such a great response from our providers and advocacy organizations that contributed photos of their staff for this video, and we really want to thank you. It was a true group effort putting that video together, and so thank you so much for submitting that. At this time, we'd like to thank you for participating in Mental Health Day at the Capitol. We know that this year's event is a lot different than what we're used to. It's really our hope that in the future, we're going to be able to see each other again in person and really enjoy Mental Health Day at the Capitol, actually at the Capitol like we normally do. That is our hope for the future. We'd really like to sincerely thank Wendy Bailey and Representative Kevin Felsher for sharing at today's Mental Health Day at the Capitol. Additionally, NAMI and the Mental Health Association of South Mississippi have really worked hard to coordinate this event, so we really want to say thank you to them. And then additionally, we really appreciate the work that you all do as providers, as advocates, and as our lawmakers in Mississippi to support people who are living with mental illness. It matters, and it's making a difference. Thank you again for being with us this morning and hanging in there with us with some technical difficulties. It always happens like this, and we appreciate your grace for today's event and hope that you've enjoyed it. Please enjoy the remainder of your day and take care.